to this edition of Dr. SM Chirisa, where we'll be discussing a very important topic, understanding alcohol and drug abuse. I'm your psychiatrist, and today we'll be dealing with this important topic. I don't want to waste too much time, so I shall go straight into the topic today. I want to start off why I decided to discuss about alcohol and drug abuse. One of the things that I have and have been privileged is I run alcohol and drug rehabilitation units right here in Zimbabwe. And over the years, I've treated hundreds of patients, and I have seen the kind of problems that drugs do to people, all sorts, and I've seen it firsthand, and the destruction that drugs can do to a family, to lives, and everybody. And not only that, but in my earlier years as a medical student, I lost one of my best friends after a binge drinking escapade. And that night, after a weekend of binge drinking, my friend shot himself with a shotgun. And a few years down the line, I then lost my other friend who practically died from an overdose of drugs. So I've seen this firsthand, and in my own family, I've seen my elder brother, one of my elder brothers, really struggle with alcohol. So the purpose of this is we want to encourage people to get help early, and we want to encourage families to ensure that their daughters, their sons, they get help, their grandsons, their granddaughters, because it's really cutting across both sexes. And the key thing is recognize it early before it gets worse, so that you can do something about it. So let's go a little bit deeper as we aim to understand it. So what is addiction? A lot of people do not know what is addiction. And so we need to define so that we'll be speaking the same thing. So addiction is a biological, psychological, and social disorder characterized by compulsive engagement in a rewarding behavior despite adverse consequences. So what we are saying is that when you are addicted, the disorder is biological. So there's a physical aspect to it. There is a psychological component to it. There is a social component to it. But it then means that somebody will continue to engage in a compulsive way, which means that they cannot stop themselves. And this is very key, because I have seen parents come to me and say, I need to beat him up. If I beat him up thoroughly, it will stop. Then I tell them, no, this is now beyond that. And some parents will come to me and say, Doc, I have spoken to him 1,000 times. But then I tell them, it's no longer, just talking to him is not, or talking to her is not going to make him stop or her stop, because it's now a compulsion. There's a problem, biological, and I'm going to explain it to you why addiction is so difficult, even for the person who is addicted. Most of them, if you really talk to them, they actually want to stop, but do not know how to stop. And they've tried even to stop by themselves. Some of them have had times when they tried to stop, tried to cut, but they cannot, because of what I'm going to discuss about here. So at a biological level, addiction is a brain disorder. It's a brain disorder. It actually affects your brain. It's a brain disorder. And what happens is this: in your brain, or in your head, there is a part of the brain which controls what I will call the reward center. The reward center. This is the center that is activated. For example, when you eat ice cream, the reward center is activated. When you watch a good movie, that good feeling. When you are eating a large pizza, that thing. When you are enjoying anything, be it food, be it scenery, be it a book, be it even sex, that same reward center is activated. So what then happens with drugs and alcohol is that they go and hijack, so they then possess that reward center, such that a person will no longer get pleasure from naturally pleasurable things. Your food, your close relationships, and all those kind of things. They only get that level of pleasure by using the drug or whatever the thing is. So these are the things, and that reward system can actually be hijacked by several things, other things. That's why people can be addicted to gambling. It actually hijacks the same system to video games, especially with this lockdown. A lot of people are getting hooked to video games or to social media. It actually hijacks that to shopping, shopaholics. It's a shopping addiction. It's the same mode of addiction which is also driving the drug and alcohol addiction. So it hijacks, and in that system there is a neurotransmitter. A neurotransmitter is a chemical in your brain that helps your brain to communicate, and that neurotransmitter is called dopamine. And dopamine is released whenever you are feeling good, feeling pleasure. Dopamine is released. So when you use drugs, especially for example when you use cocaine, the amount of dopamine that is released in that reward center is so much. It's more than the amount of dopamine that can be released by any natural stimulus, such that your mind goes boom. You have that rush, and anything that gives you pleasure, your mind wants to have it again and again and again, and then creates the addiction. And so this is very key. And that neurotransmitter called dopamine, it actually regulates a lot of other things. It regulates your emotions, it regulates your cognition, it regulates your motions and your feelings of pleasure. So because now there's dysregulation of that neurotransmitter, you are really in trouble. That's why I said that addiction is a brain disorder at a biological level. At a psychological level, it's also a psychological disorder. And you're going to see that, because then there are psychological issues, emotional issues that have to do cravings and things like that. Then and the social disorder, because when it has now come, it will destroy your social life. You will destroy, and we're going to see the consequences of that. So as a way of understanding, the take-home message I want from this definition is for you to understand that addiction, alcohol addiction, drug addiction is a brain disorder. So you cannot just come and say somebody who is now addicted, stop. I told you to stop, and you expect them to stop. They actually need treatment because it's now a disease. And so we need to understand that alcohol, yes, it can be legal. It's legal, but it can still cause addictions. So when it comes to addictive drugs, they are divided into two main groups. There's the legal route, the legal drugs, and the illegal drugs. And on the illegal drugs, you've got your in other states, for example, cannabis can go in there. In other states, it's legal, and it's probably going to be legalized in most of the parts of the earth, of the world. We've got also alcohol. It's also legal. Then we've got prescription drugs. These are legal drugs, but when somebody abuses prescription drugs, and in our world, what we see a lot is the abuse of painkillers, especially codeine-containing painkillers, morphine painkillers, and now what we are also seeing, we are seeing a lot of abuse of cough mixtures. We're going into the cough season. Cough mixtures, those ones that have the histamine and the codeine, your Histalix D, your Bronclear, aka in Zimbabwe Bronco, and many others, your Fencetil. These are things that are being used because they contain codeine, which is then changed into a weak morphine in the body, and it's very addictive. The sticking that you see with broncho is as a result of the high dose of histamine, that is your anti-itch, anti-cough, anti-irritation that is in there, and because people then take it a high dose, it causes them to stick or to just freeze. So as you can see, you've got legal drugs and illegal drugs. Now, illegal drugs, there is no use for them at all. You are now talking of your cocaine. You are now talking of your LSDs and things like that. But obviously, people that get crystal meth, heroin, and other things. So these use of these drugs, we are seeing it grow. We are actually seeing it, especially crystal meth in Zimbabwe. It's a growing menace. It's actually being used by the artisan miners, aka Makorokoza, to keep them awake when they are digging for gold underground, because it's a stimulant, and it's now being used so many, because it's quite cheap. It's $10 per gram, which is a teaspoon leveled. And for cocaine in Zimbabwe, it's being sold between 60 to 80 US, and a gram, which is just also a teaspoon. And you're going to see why it then causes a lot of problems, especially financial problems, debt, stealing, and people end up stealing things from their relatives, family, and get into crime. So we also then need to understand other definitions. When somebody is dependent, now dependence is an adaptive state of the body or the brain as a result of recurrent use, and that dependence, it means that your body or your brain cannot function normally without the drug in its system. And there are two types of dependence. There's physical dependence. Physical dependence involves your body needing the drug physically. And when you don't have the drug, you suffer what are called withdrawals or withdrawal symptoms, which means that your body is so much used to that environment with the drug. Your brain is so much used to that environment that it now needs the drug for you to act normally. So, for example, somebody with alcohol addiction, when they don't drink for a few hours, they'll start to have withdrawals, aka barbaras. They'll start to have tremors. They'll start to have nausea. They'll start to have loss of appetite, sweating, and all those. That is physical withdrawal. And that physical withdrawal is so nasty. It gives you a nasty feeling. You are so sick, such that somebody who's addicted, they now know that if I take another dose to bring in the environment, they will come down, because your brain, your body, your system is now used to you having the drugs. So when you see yourself having withdrawals, when you stop using a drug, be it caffeine, be it nicotine, be it painkillers, be it diazepam, be it whatever, it means that you have developed what is called physical addiction. There's also something that is called psychological addiction. We see this in most of the drugs, but also especially with cannabis, where the dependence has to do with emotional and motivation. So you don't have any withdrawals physically, but the withdrawals, when you don't take it, you've got an emotional dependence. You feel you want the drug. You feel that if you don't have the drug, you will not function, you will not be brave, and things like that. So that's a psychological dependence. And when we withdraw psychologically, you then feel dysphoric. You feel irritable, and you are not happy, and you've got loss of interest, and all those kind of things. So those things are very key. And one of the things that we also see when you use drugs is a term called tolerance. Tolerance is when a drug over time has got diminished effects on you. For example, when you drink alcohol for the first time, 2 pints will knock you out. But if you continue to take, you need larger amounts of alcohol to achieve the same effect. That is what is called tolerance. So this is, and this is the problem with all drugs. You may take 1 shot of cocaine today and you feel good for the whole day. But tomorrow, you're not going to need one, you're going to need two. The following day, you're not going to need two, you're going to need three. The next day, you're not going to need three, you're going to need four. And it becomes a rolling stone, and which just gets bigger and bigger, and your appetite for more for you to get the same high. And now, if you use larger amounts to get the same high, the physical effects of those drugs will start to come in. It will start to destroy your body biologically, and now you are now addicted. That is the psychological. And then you've got the social effect where you're now using more money, more time, and everything. So this is very key. Withdrawals are there's things that happens to a person when they cease to use any drug. So and the withdrawals, they differ from drug to drug, but so some are drug specific, but generally it's to do with irritable tremors, feeling nasty, vomiting, and somebody can actually be very ill. And we see a lot of people being admitted in casualties, 24-hour medical centers because of drugs. And so in psychiatry now, when we make a diagnosis of addiction, we actually, the actual name is called substance use disorder. Substance use disorder. It's a condition where the use of substance, that is either alcohol or any drug, leads to that person clinically or having significant impairment of functionality. And this functionality can be academic functionality, and we have seen this with a lot of students at universities, both abroad and within. The drug is a major problem at universities, in society, where people then end up becoming vagabonds, just roaming the streets, not achieving and their potential, and even having physical problems. I'm going to talk about one or two, and even having mental problems. And the use of drugs, in my experience, it can be single or polysubstance use, which means a person can decide to use one drug, or a person can use multiple drugs. We call it drug profiling. And what we have seen is that the younger ages, especially those that are below the age of 35 or 40, they are trying all sorts of things. So they are using alcohol, they are using cannabis, they are using meth, they're using whatever they can find. And as people get older, they sort of like choose a drift to one drug of choice, either alcohol or cocaine, but obviously there'll still be a percentage that is mixing. And the psychiatric conditions that you start to get with this is we can actually make a psychiatric diagnosis of substance use disorder. So substance use disorders are in the domain of psychiatry and psychologists. That's why I'm talking about it. So we are the ones that actually treat that condition. Remember, I said that addiction is a brain disorder. It's a brain disease. And one of the things that I've also seen is that so a person can also can manifest with a purely substance use disorder. So they're just having problems with the drugs. Or they can have mental disorders associated with the drug use. So one of the things that I've seen is that I've seen people with mental disorders that start to use drugs. So you end up having what I call dual diagnosis. A person might have a diagnosis of maybe depression, bipolar, schizophrenia, plus substance use disorder. But one of the things that we have started to see, and we are seeing, is that drugs themselves can actually induce or trigger other mental disorders. So, like, for example, when somebody has taken a high dose of cocaine or crystal meth, at that point when they're having that trip, they can actually have hallucinations. They can become violent. They can see things in that trip. So it is called substance-induced psychosis. They can actually have a substance-induced psychosis. And a pure substance-induced psychosis, after the drug has been removed from the system, the person goes back to normal. But we have also seen some people who did not have mental disorders prior, use drugs, then they have mental disorders. And even after the drug has been removed or they've been dried, the mental disorder continues. That is now called substance-activated mental disorders. So it was a disorder. Maybe this person might actually have some predisposition, genetic predisposition. but they were not going to have mental illness if they had not taken the drug. But because now they've taken the drug uncover. It's something that we talk about at genetic level, which is called epigenesis. Epigenesis, where certain genes that are hidden, that are not expressed as a result of exposure to drugs, cannabis, meth, cocaine, they expose certain genes that were hidden, which actually activate mental illness. So so there is a challenge there, and this is what we are seeing. And in practice, so we are seeing people with pure drug, and then we are seeing people with mixed, all kinds of mixtures of other mental disorders, ranging from bipolar, depression, schizophrenia, anxiety, and things like that. So before I go any further, so we need to understand that with addiction, there are things that show you that you are now addicted. Tolerance is one of them. So you need increasingly larger doses to have the same effect. The other thing that you do is you've got impaired control. You cannot control your consumption of the substance. So you say, I want to go and just take 2 pints, but when you go, you then take 20. You lose control, you lose count, and so you lose control. It's one of the hallmarks. And also there is a preoccupation of a desire to use your mind or its thinking. So you start to think about using it. You start to think about how you can get it. So all your effort, all your motivation. Remember I talked about the drugs or the addiction being a hijacking of the pleasure center. So the pleasure center is a motivating center. It's a motivating center. So when that motivation center has been hijacked by the drug, all you're thinking of all day, when you sleep, when you dream, you're thinking of the drug. So you start to neglect important things. You start to neglect your own body. You start to neglect your work. You start to neglect your family. You start to neglect things that were important to you. They are no longer as important to you because now all your preoccupation is about the drug, because that pleasure center or that reward center is pushing you. You also have got craving. Craving is you just feel this need for the drug. It's like your body is going through a tantrum, and where you just need it. You need the drug, and you can do anything. You can have. I've seen people who have a craving in the middle of the night. They will wake up and walk 2 kilometers just to go and have a smoke, just to go and have a joint, just to go and drink. And people will do things that you never thought you would do. And there is continued use of the substance, both alcohol or any other drug, cocaine, whatever the case might be, despite obvious harm and bad consequences or adverse consequences. So people will say, okay, I had an accident yesterday, but it doesn't matter. I fell yesterday, or I'm getting divorced, it doesn't matter. They're just continuing with the use. And there's also the need of immediate gratification. Those are some of the things that will show you that, look, you are now addicted. And usually after those trips of using those drugs, people usually go into depression. They usually go into guilt, excessive guilt. So after they've maybe used the drugs, the following day or the 2 days, they'll be feeling so guilty, so nasty. So they feel so bad. Some will feel suicidal and things like that. So when you've suffered these things that I've talked about, definitely you are addicted and you need to get help. If you've seen your relative, you've seen your husband, seen your spouse, seen your brother, seen your grandmother or granddaughter having these kind of things, you know that they're definitely in trouble. They need help. So what causes addiction? It's a question that I get asked by parents and by even my patients, and say, what causes? Obviously, there is a genetic component to it. I always give an example that out of 100 people that are going to use, for example, cannabis at a very high, only 10% or so will develop problems. 5% of those that are using alcohol will become alcoholics. But those 5% is significant if you multiply the number of people that take alcohol. They are in the millions. So we've got hundreds of thousands, if not millions, of people that are addicted, And So there's a genetic component. Some genes are stronger, some genes are weaker, and it tends to run in families, especially when you look at alcohol. So if you want to look at if there's somebody who is close to you who is alcoholic, or he's got alcohol problems, or you've got some disorder as a result of drugs, you know that there might be a genetic loading in your bloodline or in your genes, and it's something that you need to check. And I've seen families, brothers, mother, father, having to come for rehabilitation because there's a genetic. But also the reason why those genes do not express themselves 100% is because they are what I call environmental factors. And I'm going to go through some of them. And especially if you are parents, these are things that you really need to watch. And you can actually help your family avoid this problem by watching these environmental, which I call psychosocial stressors. Number one is lack of parental supervision. I know a lot of our relatives and friends, they're to leave the country and go to other countries, the United States, to the UK, Australia. But what they did is that they left their kids here. And when they left their kids here, they did not have that parental supervision that they should. And that lack of parental supervision led them to early use of drugs, early use of large quantities of drugs, because there was nobody who was checking on them, and so they were really free to do what they want at an early age. I've seen Form 2s being left to themselves, fend for themselves, and all they do is to have house parties, drugs, and all these orgies. And so lack of parental supervision is an environmental factor which leads to a lot. So I'm urging parents, monitor your kids. Talk to your kids. Be with your kids. When they come after parties, see what they are doing. Make sure that they don't go into huge drug. But if you don't monitor that, they are going to do it. And by the time you notice it, they'll be addicted. One of the things that we have also seen is parental use of drugs. So one of the key predictors of becoming an addict or using drugs is when a parent or a caregiver, somebody that you're staying with, uses. So if the father is using, the mother is using, the probability that the children, so if you at that point is not don't do what I do what I say, will not work. People will do exactly what you do. So parental use of drugs, especially hard drugs, cocaine, and I've seen families sharing. I've seen mothers sharing with their boys. I've seen boys sharing with their daughters. I've seen fathers sharing drugs with their daughters, and leading to addiction. So parental use of drugs is one of the biggest predictors of use within the prevalence of peer substance abuse, which means that you need to monitor if you are in a group of people that are using drugs. And what happened is that people will start to use what we call gateway drugs, your alcohol and your cigarettes. We call them gateway drugs. But the same people that are selling cigarettes in your neighborhoods are also selling cannabis. Every person that is selling cigarettes is probably also selling cannabis. So you go there wanting to buy cigarettes, but then you end up buying all the joints, all the nightclubs that are selling alcohol. There'll be somebody in there selling harder drugs, selling cocaine, selling within that space. It might not be the owner, but somebody in there is peddling and pushing these harder drugs.